I am Dr. Ramnarayan, consultant functional neurosurgeon. I have been talking about the various problems of the brain and the spinal cord, where the functions of the brain, spinal cord and the peripheral nerves are affected, and how surgery can be done for some of these patients to make their life better. Now I will go to another very common topic. In fact, I will call it a very miserable topic because it involves a lot of suffering, and this is cancer pain. Our body is very funny in that there are only some organs which can feel pain. For example, if you take the brain and cut the brain, the patient won't feel any pain. If you use a needle and prick the stomach, the patient will not feel a pain. But if you pull the stomach, the patient will feel a lot of pain. So like that, every organ has got different sensation of pain, and some organs do not have any pain sensation. Now, I'm sure all of you know about cancer. There are various types of cancer. In fact, most of the organs are affected by cancer. And one of the commonest problems with cancer, which does not usually exist with other disorders, is that the spread of cancer to distant organs. For example, a patient with a cancer of the stomach can have the cancer spreading to the brain, or the cancer can spread to the spinal cord, like that, because the cancer cells can get into the bloodstream and travel to various parts of the body. This is called metastasis. Of course, all of you know about treatment for cancer. Surgical options are available. Radiotherapy is an option. Chemotherapy is another option. There are so many gene therapy, so many therapies are there for cancer patients. But invariably, most of the treatment over a period of time do not work or not effective. And then the cancer cell starts moving to various parts of the body. And some of these parts where the cancer cells settle down can be very pain sensitive. For example, the spine, the bones of the spine, the vertebrae, they can be very pain sensitive. Unfortunately, these patients, when they reach the metastages, or what we call medically at stage 4, are told that there's nothing much we can do. Your longevity is not much. You may not survive for a long time, and there's not much treatment for you, only palliative treatment. So obviously, this causes a lot of depression on the patient, because when you know that you are not going to survive for a long time, and you are obviously not very happy. This causes depression, and depression itself leads to pain. Along with that, the cancer cells can settle down in various parts of the pain sensitive parts of the body, like the spine and all that, and cause severe pain. This is cancer pain. In fact, it is if you want to believe cancer pain, you have to see a patient suffering. It is such a miserable condition, very, very miserable condition. How do you treat cancer pain? The main treatment for cancer pain all over the world is morphine. Morphine can be given as injections or tablets. In fact, even in India, from the cancer institutes and all that, you can get morphine tablets and injections. But obviously, the biggest problem with morphine tablets or injections is a significant amount of side effects, which some patients say that it's better to suffer the pain rather than suffer the side effects of morphine. And the other thing is, obviously when you take higher and higher dosage, morphine causes a lot of sedation, and so your active few days or few weeks or months in life is spent on just sleeping, which obviously is not going to be good, because you may have a lot of social commitments before you pass on to the next world. In this scenario, we offer what is called intrathecal morphine injections. That is, we put a pump under the skin here. This pump is 40 ml capacity. We fill the pump with morphine, and the pump delivers morphine directly into the spinal cord and the brain. In the brain and the spinal cord, there are receptors of morphine receptors, the natural painkiller system, which helps in reducing the pain of the patient. The advantages of this pump are, you can adjust the dose. You can give what is called, so suppose just like when somebody is having severe pain, they go to a doctor and get a intravenous injection. We can give a bolus injection. We call it a bolus injection, which can be controlled by the patient. The dose can be controlled by the patient, and it is continuous 24/7, 365 days a year. So there is no pain in between. The dose is very, 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 very less compared to the tablet or injection form. For example, if a patient requires 200 milligram of morphine tablet, he will just require 1 or 2 milligram intrathecally. So naturally, when the dose is very less, the side effects are also very less, and other problems like addiction and tolerance and all does not exist.